Any conflict of interest on the agenda as presented to you this afternoon? I hear none, and and then we'll move on to 4.0, our medical officer health update. Dr. Nazatiri, please.
So thank you, Mr. Chair, Mr. McNamara, members of the Board of Health, my colleagues. I appreciate the opportunity to share my thoughts today. I want to talk about cancer. Cancer kills people. It kills people in Windsor-Essex. Many of the people who were killed died too early. In the jargon of the Public Health Service, we call them premature deaths. It's clear to me that every family, every household, every community has been touched by the burden of cancer. Cancer accounts for about 30% of all deaths, although many of the people who die of cancer in the twilight of their life. About half of all cancer deaths are people in their 50s, 60s, and 70s. Save for the cancer, they may have lived many more years. In Windsor-Essex, there are about 1,200 cancer deaths per year. The common cancers are lung, colon, breast, pancreas, prostate. So I wanted to talk today briefly about what the Public Health Service is doing to try to reduce the burden of cancer. Public Health Service has really two types of strategies. One is promoting health, and the other is protecting health. And the Public Health Service is working in both of these areas to try to diminish the burden of cancer to the community. Lung cancer is a terrible disease, and smoking is the biggest modifiable risk factor. At the Windsor-Essex Public Health Service and the Public Health Service throughout the province and the country, working on education to try to prevent young people from never starting to smoke. At the local level, the health unit is involved with counseling people who are trying to get off cigarettes. My colleagues today told me that on average, there are about 40 to 50 people at any given time being enrolled in smoking cessation programs, and that includes nicotine replacement. That is to give medicines to try to get people to substitute for their cigarettes. Also, the health unit has 5 tobacco enforcement officers. They're trying to enforce Ontario's Smoke-Free Act. The reason it's important to have tobacco enforcement officers is because it's one strategy to minimize the availability of cigarettes at retail outlets for young people, at least diminish that channel of availability. And the health unit, working with others and members of the Board of Health, have advocated for bylaws to try to limit smoking at workplaces, both indoors and outdoors. Despite all of this, 1/5 of all people are currently smoking in Windsor-Essex, about 1/5. And the one message I'd say is that we do want to help people quit smoking, but we also want to provide them with compassion and understanding as they too are suffering from an addiction. The next cancer I'd like to talk about is cervical cancer. The health unit has been upfront advocating for strategies to reduce cervical cancer. The one tool that we have in medicine and at the Public Health Service is to advocate for vaccination. Cervical cancer can be prevented with vaccination. One of the numbers I was quoted was that if we get to our 95% goal across the country, we could save maybe 1,750 lives. A staggering amount of people that might be saved to get our vaccination rates up. And the Public Health Service in Windsor-Essex, as well as in other places, has been advocating for HPV vaccines. Public Health Service staff go out and vaccinate young people in schools. It happens on a regular basis. The other part of trying to manage cervical cancer is screening. Colloquially, it's known as the PAP test. And in Ontario, typically people are screened every 3 years. So there are approaches to managing cervical cancer. I'd like to shift to breast cancer just for a minute. Breast cancer is also something that's amenable to screening, but only about 60% of the women in Windsor-Essex are getting screened at the current time. I'm going to say what the benefits of proper public health practice are in the words of Cancer Care Ontario. I think they say it better than me. Getting screened regularly with mammography is important because it can find a cancer early, and when it's less likely to spread to other parts of the body. Treatment may also have a better chance of working when breast cancer is found early. The second point that they make is when breast cancer is found early, almost all people will survive for 5 years. However, if breast cancer is found late, only 2 out of 10 people will survive for 5 years. Despite that, our screening rates are not where we want them to be. And we have to work on that as a community and as a public health service. In preparing for today's talk, I was reminded by what Edison said earlier in his life. He said, "The doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and cause, and in the prevention of disease." You know, to update Edison's thoughts for today, I'd say the real goal is for the public health service in battling cancer continues to focus our efforts on prevention. Thank you so much for allowing me to speak today and speak so freely, and I'd be happy to answer any questions.
All right, thank you very much, Dr. Nazateri. Any questions or certainly comments to the good doctor here? And just a comment from me. Probably some are aware, but maybe you're not aware, Doctor. I'm a cancer survivor, 11 years now, and I had colon cancer, and back in 2011, and a lot of it was on diet more than anything. I love my steaks, and I could eat them 3 times a day, 7 days a week. The good news is that they're out of my price range now, so I kind of, but there was a huge lesson to be had, you know, on certainly. So lifestyle does play a huge role into it, and I was one of the fortunate ones that I caught it early enough. And I never got beyond stage 2, so that was a blessing. And but I can tell you now, I do watch what my intake is, and I'm I'm a little bit heavy-handed on my kids, you know, in terms of them as well. But those are great conversations, and I think for the lack of, and you know, the thing is that cancer is not a death sentence like it was 30 years ago. But having said that, if you can't help yourself, then it can become a huge problem in that regard. So thank you for the chat. I think it's important, and it's good for the general public also to know that we all have a little bit of responsibility to take care of our bodies, and most importantly, checkups. If vaccines are the order of the day, take advantage of them. You know, so there's a huge opportunity for us to not get into that range. And you hit the mark really right on. It was in my early 50s, and it was a rude awakening and a shock to the, you know, at the time where you think, you know, at 50 you think you're 30 still, but you look ahead and I said, geez, I got supposed to have another 30 years ahead of me. And so it's certainly an appropriate conversation to have. Appropriate conversation. Comments? Yes.
Sorry, did you say me, Judy?
Yeah, go ahead, Judy.
Okay. Thank you, Dr. Nazateri, and Chair. Through the chair, I think cancer awareness is always something really important. This area has a lot of radon as well, and I think as housing affordability becomes a bigger concern, I think that the issue of physical and health reps are always to remember again that we have to encourage the government to look at issues of mitigating radon in part of the grants and other type of green initiatives they're looking at for the community, that this is an important issue, particularly in an area down here that has high lung cancer rates and also higher radon rates. And I really appreciate you bringing up the information on cervical vaccination. I think if we had a vaccine for breast cancer or prostate cancer that was as successful and had the potential to save the percentage of lives that we do with cervical, people would be jumping all over it. So I think that we can't promote the cervical cancer vaccine enough to the community. So thank you very much.
Thanks, Judy. Any comments or rebuttal there, Dr. Nazateri?
No, two things, and one is that we wanted to talk today, and I do appreciate the opportunity to speak at these meetings. The Public Health Service, COVID is important, and we're definitely working on that. And infectious diseases are important. We're definitely working on that. But there's a whole group of things that the Public Health Service has been working on that I also think are priorities, and prevention of cancer is one of them. I really appreciate board member Judy, and forgive me for calling you by your first name, but I really appreciate her comments. One of the barriers to getting people vaccinated for HPV is for all of us having to contend with the fact that our children will one day be sexually active. Because the benefit of the vaccine is substantively before young people become sexually active. That's why we give it at that while they're in middle school. But I think the honest discussion about trying to prevent the cancer in our children is something that transcends everything else. And if we can speak boldly about it, I think that would be great. The Public Health Services wrote an op-ed piece and put it in the Windsor Star, and it got so. The more we can talk about HPV vaccine, I think the more that we can advance the health of young people as they enter adulthood. So thank you for that.
Okay. All right. Any further questions or comments? Okay, hearing none. Thank you again, Dr. Nazateri. And I think your hand's still up, Judy. Okay. Move on to approval of minutes, regular board meeting minutes of October the 20th. I motion to receive those minutes. Thank you, Reno, and do I have support? Thank you, Judy. Any errors or omission on those minutes as presented? Or hearing none, I will say oppose. Then those minutes are approved and carried. Thank you. Business arising, 6.1, Board of Health bylaws and policies for approval. That's on page 7. So we'll start with public attendance and delegations at our Board and Health meeting. No, Ken, are you gonna speak to those?
Oh, I was just wondering who's, I think that was assigned to me. So, going for next year, as of January, we do want to be able to get together again in face-to-face for our board meetings. And Lori has looked at procuring some sites for us to be able to do that. We're going to be doing most of them at the University of Windsor. And we will also have a few in the Civic Center, I believe, in Essex, if that's correct, for 2 of the meetings, I think, next year.
Yes, June and October.
Yeah. So we just wanted to make sure that we came forward to the board with that. I guess with that change, I know we've been having everything virtual, but I think the face-to-face piece is going to be very important for us going forward with a new constituents as part of our board in the educational piece. And also for them to be able to kind of interact a little bit with the staff before and after the meeting, if they have any questions in terms of their education, to get them up to speed as to what we're doing, here at the health unit. Are there any further comments, Lori?
No, none at this
We're
time.
good.
No, I think it's appropriate. I think it's an opportunity for us. There's no doubt that Zoom or Team will always play a role, even in for executive meetings and of the like. And but I think the board getting together, I think is kind of a normalcy, but under the auspices of also looking at the protocols that we should continue to meet as a process. Okay, so I don't believe we need any. Well, I'm get a resolution for the board on that, so that it's on the docket in our meeting, in particular with the new members that are coming on board. Moved by Judy. Do I support? Thank you, Reno. Opposed to the motion? The motion carries. Thank you. Delegation of duties. I think for most of us that are in the municipal world, we've certainly have lived it in the last couple of months during the election. So anyway, Ken, if you want to bring that item forward as well, please.
Sure. So Lori and I, or actually Lori's done the vast majority of the work on this, connecting with the ministry for having some defined parameters of delegation of duties. So we have provided you in that package certain elements that we feel would be key elements that we'll probably encounter within the next, well, could potentially be up through January, I would believe, right? We're not quite sure when all the boards or the delegates will be selected. So I can't go through them in detail, or we could open it up for any questions in there from the board itself, or what would you prefer?
So Ken, I believe this item should be handled in camera.
Okay. Yeah, to speak with the details, yes, we should have that in camera.
Absolutely.
Yeah, for a couple of them.
Okay. Back to my agenda. 6.1 and 3, the performance MOH and CEO that should be at the tail end of the month. I firmly believe that those are issues that should be covered, and even though I think it would be more on the CEO, would be the past year. I think Dr. Blanchette, you're still on the honeymoon stage, certainly on that piece, but those are important facets on a yearly basis. And if you recall, when you were a board member, that those duties were allocated to JBEC, and when we actually had the opportunity to meet with the MOH and the CEO of the day, and then put before them their performance review. But I do believe we still have the standard, Lori, and you're on with the standard forms that we utilized before, where the as usual, where the MOH and also the CEO would fill accordingly to their past performance within the year, their expectations, also moving forward, and also what the accomplishments and if they achieve the strategic direction of certain accounts. So I think we still have all of those in-house.
I would defer to Dan.
Yeah.
Yes, Mr. Chair, we do continue to have all those annual performance appraisals, and at the obviously at the right times I'll work in coordination with JBEC to make sure that those forms are completed by both the CEO, MOH, and then setting up the meetings to ensure that the JBEC reviews the performance of the CEO and the MOH.
Okay, perfect. Thank you. Any questions or comments? Judy, is that an old hand that's up or a new one? Okay, must be a old hand that's up. Okay, so then, I think that for information, basically on that particular piece and that, but 6.14, bylaw, number one, the governance, and it starts up page 6. You can see the requirement there, members of the board.
Gary, Chair, I have a question on the bylaws.
Yep.
It's Judy. So I just wanted to, these bylaw changes are all being made in occurrence with, concurrence with the ONCA requirements that need to be completed in the next 2 years. We follow ONCA, correct? The Ontario Nonprofit Corporations Act.
So Judy, we did this, we had legal review these. So I would have to ask that specifically. I assume that they were followed, but I would have to confirm with legal that they did ensure that those requirements were satisfied.
Okay, I think that we should be doing that because all the nonprofits under the Ontario Nonprofit Corporation based on their new regulations within 3 years from last October. So I just think that it's something I hadn't heard it mentioned, so I wanted to just make sure that we were following up to make sure that was done. Thank you.
Okay, thanks, Judy. So Ken, what are we looking for here today in terms, I know these are before, the changes have been amended and changed. And you're looking now for a resolution from council. Okay, and I don't know if the board has the opportunity to look at them. Is there anything do you want to bring forward, Ken or Lori, in terms of deletions and additions on that, just to be reflective? Because right now, basically what I see from what I can gather here is just the governance piece or the finance piece and so forth. Can you run down the old to the new or any changes that have been there? Because a lot of it is bringing it up to 2022 and certainly beyond.
So I can provide some summary comments. So the previous bylaws had a substantial number of references to legislation. Those have been removed. Additionally, I think there were certain aspects of the bylaws that had policy embedded within. So some of the policies that you've seen being brought to the board as of late are as a result of us extracting those pieces of information from the bylaws and putting them into the policy. So for example, public attendance and delegations of the board, that was actually delineated in the bylaws. I will say the finance bylaw, there were some key aspects that perhaps weren't broached. I think around insurance and legal and making sure that there's regular frequency in regards to, when we go to market to procure, or making sure there's policy in place to support. So one that stands out to me is the borrowing policy, for example, making sure that we are compliant, we have a borrowing policy and that we comply with that, and we regularly bring it to the board for review. The procurement policy as well is another policy that, again, we embedded within the bylaw, remove some of the detail and the nuances that were in the bylaw previously about dollar values and amounts, and put those in the policy, and then required that the policy be brought back to the board for their review and approval on a regular interval. Management of real property. There were some minor references in the previous bylaw about real property. Again, this was, I feel, was more detailed and offered, identified more of the health unit's responsibilities in terms of real property in a separate bylaw unto itself, which is very similar to what other public health units have. So throughout the process, when we endeavored to go through and revise the bylaws, what we attempted to do was use other health units, their bylaws as a basis for and a reference as we were going through and compiling. So again, ours was very onerous, was very cumbersome, and these are more succinct and to the point. Trying to think if there are any other things that stand out. I feel that the governance, if I had to speak on each of the bylaws, I think the governance bylaw, for the most part, was really just a reorganization of the information that was in the previous consolidated bylaw, and again, the removal of a lot of those references to legislation and such that may have changed over time.
Yep. Okay. Moving forward on as we continue to build on the bylaws and so forth, especially moving forward in that, I would recommend, and what we had done in the past, I remember when Dr. Kirk was there, it was brought up at the time and discussed. We kind of had a governance and part of the audit and governance committee. And I really believe that would really be well used and utilized if we were to, when we go through the process of, the election of the chair, vice chair, treasurer, and so forth, is have the governance audit committee, and also have someone, some members with that one or two members on that committee, and obviously, we could add a chair of the audit and governance committee, because obviously it seems anymore that, a lot of it is updating the requirements because of legislation and as it changes, and it's kind of like, adding on and so forth to make sure that we're still compliant within within the governance structure and the bylaw structure and so forth. And that's where it's an opportunity on a yearly basis, for that particular committee to work with yourself, Lori, and certainly Dr. Blanchette, and to bring back and bring forward any portions of the bylaws that need to be amended at any given time. And so although it's a lot of work, and no kidding, it's a fairly complex and large document, but realistically, it's a living document, right? And so you have to prepare for it and so forth. So that, moving forward, once we deal with these four here, I would recommend, because there's a lot more, to it, and that should be part of our kind of our strategic outlook a little bit in terms of on the governance pieces, to add the the audit and / governance committee.
I would agree, and I think Dr. Blanchette may have already alluded to that we were going to strike some sort of a policy or governance committee to deal with things such as the bylaws and other type of board policies to ensure, again, there's that appropriate engagement.
Yeah, no, I think that would be wise, and like I said, I mean, it's a complex issue, and in particular, with a whole new, well, I would say not whole new, but a large new contingent of members of the board as well. It would be very important for us to understand, the do's and don'ts, and the why and why nots, and so forth. So, I would include kind of a 6.1-8 to that, if possible, that we do look at adding a audit and bylaw committee. Any questions or comments? All right, pretty quiet on the Western Front here. Okay, if there's no questions, then if I could have a motion then to accept the 6.11 to 6.17 with the addition of the audit committee. Thank you.
Moved by Reno.
Joe Bicchetti and Tracy Bailey. Thank you. Any opposed to the recommendations? Hearing none, that is carried. Thank you. We'll move on to the consent agenda. They're for information, but I think, I think these are important pieces because I know on the middle one, I've been called by CBC to make my comments on that. I haven't had a chance. I've been meetings mostly all day, but I'll start off with Q3 report, Lori, and as we are entering the fourth quarter of our calendar year, and in particular where we stand moving into 2023.
So I'm just going to share my screen, everyone, because the presentation it's just simply a presentation today, not a full report. So on October 31st, we submitted to the Ministry of Health our Q3 financial report with estimates of how we forecast to complete the fiscal year. So I'm going to break this down by funding pot. So our mandatory program funding, we have a budget of $23,287,473. At September, we are just over $50 million spent, but we forecast being fully spent at $23.2 million. And inclusive in that is there will be a payment that we will be required to make to the university on account of the construction costs that we'll be incurring prior to the end of the year. So that has been incorporated in that estimate. Our Ontario Seniors Dental Care Program, the budget for that was $2.3 million. Again, 1.5 is anticipated. It was spent at September 30th, and it's anticipated that we will be at 2.38 million by the close of the year. I did identify a variance, and what this variance relates to is the ministry in their approval for the 2022 year prorated the dollars that we requested. So there's roughly $176,000 variance in the funding that they are going to give us as compared to our budget. So I think they approved just over $2.2 million. We have submitted a one-time business request to fund that shortfall as we are looking to deploy dollars to refer clients out to our community to reduce waiting lists, in particular in the Ontario Seniors Dental Program.
Okay, any questions?
Sorry, still more slides.
Okay.
So the COVID pieces. So we have a COVID general program and a COVID vaccination program. In our budget for COVID general, we had budgeted $3.1 million. At September 30th, we were at $2.3 million, and we're forecasting to be $2.4 million at the end of the year. So as some of you may recall, these funds are, the ministry does review how it is that we progress as compared to budget, and they adjust their funding as a result. They're committed to funding the COVID programs, but again, they're conscious that other health units may require additional funding. The vaccination piece, we had budgeted 5.3. Our actual at September is 3.1 million, and we're forecasting 3.7 to finish the year. In here, we had anticipated a lot more resources to be deployed to the vaccination efforts. I will say that we had anticipated that school-focused nurses funding would not be available at about halfway through the year. So that is, that plays quite heavily into why we are not anticipating to spend that full $5.3 million at the end of the year, because we were successful in getting that funding. From a one-time perspective, there are 3 one-time requests that we were approved for. The Public Health Inspector Practicum, we were approved for 4 practicum students at $10,000 each. At September 30th, we're forecasted to, we have expended that dollar value so that we will be, so by March 31st, which is the time frame we were required to spend by, we will be fully spent. Needle exchange, all public health units were given $19,000 to fund their needle exchange programs. That is syringes, needles, and disposal costs. So at September 30th, we had not yet granted that money forward to the organization that does our needle exchange program, but we will be doing so before that March 31st deadline. And then lastly, school focused nurses. I will highlight that this approval here is strictly to December 31st, 2022. So we will be fully expended those dollars by the close of the year. I will also highlight for the board that we have been approved. The school focused nurses funding will continue until June of next year. That is 19 nurses at $100,000 each, prorated at 50%. And that is the last slide. If there are any questions, happy to answer them.
All right, thanks, Lori. Questions or comments? Okay, a motion to receive the report. Judy, thank you. Your support.
Gary Kashak.
Thank you, Gary. Any opposed? That motion carries. Thank you. We'll go to 7.2, Windsor-Essex County Living Wage Program. Eric?
Yes, thank you, Mr. Chair, and good afternoon to the Board of Health. The Living Wage Program is in place to raise awareness about the true cost of living in Windsor-Essex County and to advance policies, partnerships, and practices that promote health and well-being in our community. The program aims to provide education about what a living wage is and why it's important, and it also encourages local employers to become living wage certified. The health unit took over the leadership of the living wage program, including the calculation to lead to the actual calculated living wage released on an annual basis, which has been shared with the Board of Health through an information report like this since we took it over in 2017. For the first time this year, we've decided to partner with the Provincial Living Wage Network to build our capacity around promotion and advocacy for advancing the living wage in Windsor-Essex, using provincial channels through which to do so. That said, we have now been a part of what's known as the Southwest Economic Region. So our living wage incorporates both Chatham-Kent and Sarnia-Lambton, and this was a change that was brought about at the provincial level. What's worth noting, though, is that locally our own cost of living is reflected through things like our nutritious food basket calculation, which I shared in a report last month. So the living wage calculated for this year is $18.15, which exceeds the minimum wage, the legally set minimum wage of $15.50. You'll see in your report the incremental increases and the difference between living wage and minimum wage year over year since 2018. Our work now is to promote the living wage locally to employers, to share this number with our partners at the municipal, at the business level, to ensure that they're aware, and to advocate further as appropriate through the Ontario Living Wage Network for increases in the minimum wage. And I have also Gordon Thane, who's the department manager of the Chronic Disease and Injury Prevention Department here, who can answer any questions with me if you have any at all.
Questions, comments? No? Okay. Thank you, Eric. And there's no doubt we've realized in the last 6 months, and that if anybody likes to go grocery shopping, they'll realize, that those numbers are justifiable. And so we certainly appreciate all the work that your department and yourself have done, in that. And I think there's a misconception out there, because I think from my assistant that here got the phone call from the media, is that we're going to give everybody a 9.3% wage increase, and and that's not what the 9.3% is about. It's about bringing it from the minimum wage to a so-called livable allowance, in that regard. So that's where the 9.3% comes from, and so forth. So that's great, and I'm sure after today that we'll have that reflected certainly on our website, and I think it's something that we should be hitting the social media, certainly as well to help promote that.
Absolutely.
All right. Further questions or comments? Hearing none, then a motion to receive the report of Eric. Okay, you can raise your hand, guys, and then I'll be able to see, or your voices.
Moved by Reno.
Thank you, Aldo. Reno, support. On the motion, anyone oppose? The motion carries. Thank you. All right, back to the agenda. 7.13, our obviously our communications report, and you're still on, Eric.
Yes, the report's in front of you. There's not too much to highlight out of that, but I will say there was a very positive communications effort spearheaded through our administration and with a number of partners last week, advocating for people to stay up to date on their vaccines in light of the triple threat of respiratory illnesses circulating in the community. That letter was co-signed by Dr. Blanchette, Dr. Necessary, the leaders at local hospitals, as well as their chiefs of staff, the Essex County Pharmacists Association, and the Essex County Medical Society. And so we did get great media uptake on that letter to promote vaccination across the community.
Yes, I think that was a great message, and we've seen all the difficulties we've had, and especially with the our emergency wards are in the hospital running at about 110 to 115% capacity, and so that gives you a message that there's a way to stay away from the emergency wards, and it's just a shot in the arm. And so thank you for the report. All right, a motion to receive the communication piece. Judy moves, and support by
Gary Kashak.
Thank you, Gary. On the motion, any opposed? The motion carries. Thank you. No correspondence to report today, members of the board, but and also on 8.0, we have no resolutions or recommendation reports there. We have no new business to bring forward, but I'll give obviously an opportunity for the board if there's any new business that they want to bring forward at this time. Okay. Before we move into camera and that lose everybody, I certainly want Reno and Aldo just to put their cameras on. Don't be shy, guys.
It's on.
Okay.
So
Maybe I can ask Eric to take his camera off, and that's so everybody can get their shot here. All right. I want to, as we know, for both Reno and Aldo, this is their last meeting here certainly at the health unit, and I want to take this opportunity on behalf of myself and the board, our administrative team, and I want to thank both of you for coming forward. And I know Reno, you've been on our group for the past 4 years, and as the vice chair of the health unit, and I just want to thank you for obviously your support of the health unit, your advice, your inclusion, and most importantly, your passion for public health And looking back and looking forward, I just want to say that there's going to be a part of Councillor Bordelin embedded in the legacy of public health. And when we look at our safe injection sites and improving the core area of the city of Windsor, you've done that with a tremendous amount of passion and professionalism, and your involvement on the board has been exemplary. And so I want to, it is a small consolation, and obviously that we lose that type of experience at the time, but I'm sure you're not going to fade away into the sunset. You'll still be highly engaged and involved in your community, because I believe that that's the Reno Bordelin individual that it's going to continue to challenge the community to be the best that it can be. So on my behalf, Reno, I want to say thank you for everything that you've done, and for your indulgence at our meetings, your compassion, and also the wise input at all our meetings. Aldo, as a member of county council, and then when there's movements that we needed folks to come on board at the health unit, and you didn't hesitate 1 minute in those terms that you wanted to be part of the organization, and but again an individual that has worked tirelessly for the residents of Amherstburg and certainly for the county of Essex as a whole. I want to extend my thanks to you on a personal level for your professionalism, your leadership, and friendship as well. And on behalf of all of us at the health unit, we want to thank you, and again wish you well in your future endeavors, certainly to both of you. And I know, although you're not going to fade away also in the sunset, I think you're going to be certainly missed. But we know that you're going to still be very passionate about that corner of the county, and so again, thank you for your service to your community. And we all know it's not the easiest thing, and in particular the health unit itself, in the last 3 years, and dealing with a pandemic, and for us to be the face of the health unit, supporting our hardworking staff and leadership team. There's no doubt that we got through it, and I do believe we've got a few scrapes and bruises, but at the end of the day, all of us, and including all the board that have been here, thank you, for your professionalism, your passion, your hard work, and I firmly believe the health unit is better today than it was 4 years ago, only because of the hard work and the delivery of governance by each and every board member. So it's been a pleasure, leading you guys in the last few years, and so we wish you well. Stay healthy, and until we certainly meet again. Reno?
Thanks, Gary. I just wanted to say a couple of things. And I appreciate that very much. Very kind words. I wanted to reiterate something I said last night at council. Is like the work that I've been able to do with the WECU has been some of the most impressive, and mostly because of what you just stated. There's anywhere between 10 and 14 board members, depending on the complement at any given time. So there's 10 or 14 faces of the organization. And we're sort of lucky that we get to go out and be the faces of the corporation or the entity, the organization. But COVID really, it was an incredible challenge, changed the face of public health in this region. If you ask people what public health did before that, you would be hard pressed to get an answer other than a funny quip about egg salad sandwiches or something like that. But the immense pride that all of us as board members, community members can look back at how WETU not just worked through the pandemic, but led during the pandemic. The staff, all the way down to, the most junior members, all the way to the most senior members, really were instrumental in making us proud to be board members, proud to be community members that were leading this organization. So a huge special thank you to the staff. The executive staff have had to deal with turnover. We lost our medical officer of health. We found one, we lost one, we found one, we lost one. We have one that's temporary. And so, and the CEO role, we've changed it twice now. And in that time, everybody's taken it in stride, accepted the change, and actually rise to the occasion at every time. So being on these types of boards has actually been a true privilege, because you get to see the caliber of work of people that are exceptional at their jobs and exceptional in the roles and guiding us through as a community. So I wanted to say thank you to everybody at the health unit, from the bottom all the way to the top, because it's been a privilege to be a board member. And as Gary said, I won't be going away. There's probably, when issues come forward, whether you're bringing them to council, whether it's things that come up at the board, I will not be shy in advocating and representing sort of my perspective on things. So good luck with everything. Every new board and every new time will have a new challenge. The new makeup, I'm sure, will lend itself well to keeping that motion moving forward. Lots of great projects. The university partnership is a huge thing on the horizon. So congratulations, good luck with all of that. And thank you, Gary, for the kind words.
All right, thank you, Reno. Aldo?
Thank you, and thank you as well for the kind words. I know the last couple of years have been anything but a party, but coming in at with 1 year left in the term, I can't help but feel like a bit of a party crasher, I think. What I'd like to focus on is the work that the health unit does, staff, administration, and the board. Following up on what Reno said, before the pandemic, I think most people would be hard pressed to tell you what the health unit did in their community. I think I was probably one of the few, for various reasons, that had an idea of how important they were to the community. And it took a pandemic, I think, to really make people appreciate how important the work that's done here is to keep the communities healthy. And so I just want to make sure that I thank everyone involved. And certainly, although a short time, it has been a privilege serving on this board with all of you. And so I congratulate you and thank you for getting us through these very hard times. And I'm looking forward to business as usual from the health unit and stop dealing with pandemics, I guess.
Thank you very much, Aldo. All right, any further comments? Okay. Well, thank you very much, gentlemen, and certainly to the board, to all the members. Hopefully, for those in the municipal context and that have experience here on the board, I hope that you sign up to certainly come back, and so we certainly need some continuity there, and then our provincial partners, I know you're still going to be there and to help us navigate again through 2023. So, and again, thank you to all of the board members. Dr. Blanchette.
Thank you, Mr. Chair. I just wanted to add a couple of comments, at least on behalf of the health unit itself. Although I was not in the role as CEO, I know very well how much work all of you have put in. Reno and Aldo, thank you so much for everything that you've done, for jumping in. It has been a tremendous few years with the pandemic, but also to the rest of the board. You know, Mr. Chair, everybody else on the board, we know that we may be, there's a change that could possibly happen. From the health unit's perspective, we are truly hopeful that we see many of you return after the selection process has been done. And a friendly reminder to our wonderful, councillor and mayor that are leaving, that there are other opportunities for you to be on the board other than on council as well. So I'll just end with that wonderful hint. We'd hate to lose very good, participative, and well-informed and well-read advocates for public health. So thank you all for all of the work that you've done.
All right, thank you, Dr. Blanchette. Okay. Still have a little bit of business to finish, and if I could have a motion to move in camera under section 239 of our municipal act, and a call upon Councillor Bordelin and Mayor DiCarlo to move us in closed session. All in favor? Opposed, if any? That is carried.